If you're dysregulated and chronically stressed, you're actually never going to be better because you're stuck on illness. Like your system is
Mhm.
like, you could have the mold, the urine numbers go down and the mold looking better and still be unwell. Lyme, mold, parasites, and more. That's what today's episode is about. And I don't think we spend enough time talking about it because so many of you out here who are suffering are probably dealing with one of these things. Now, that doesn't mean that everyone in the world has it, but if you're unwell, if you're in this fear and you're still not getting better, you definitely need to consider that. Anyway, this week's guest, Dr. Jaban Moore, is a chiropractor who uses functional medicine to help people with chronic issues. And he knows what it's all about because at 25, he went from an award winning athlete to being completely bedridden. And he got himself out of that. He was diagnosed with Lyme disease, and then he committed to helping others identify the root cause of their symptoms. So now he specializes in Lyme, PANS, PANDOS, parasitic infection, mold, environmental toxicities. He's doing it all. And I really love the order in which he does things. He doesn't just throw it all at you. He really has a very particular order that he gets it all done. So it's time for you guys to meet. Let's go. Dr. Jaban, I am so happy to have you here with us today.
I'm really excited to be talking about the medical disruption world because this topic is everything. I love just going against the grain and making sure people see what's real and educating them on what I like to say is like the real informed consent, like getting the real truth out there.
Oh, I love that. The real informed consent. Say more. Tell us what that means to you.
Well, that for me is this. When I was sick, when I had Lyme disease, when I was 25 years old, my body was crashing after I was a college athlete, when I was in chiro school, when I was eating well, and I kept asking for help, and all I was getting was try this medication. Or even when I went to functional medicine and it was try this supplement. And no one ever gave me an answer. I was just looking for what is the root cause? What is the answer to why I feel this way? I look good. Like externally, I had
Right.
gotten fit. I was sleeping. I was taking care of myself. I was eating well. I was tracking my macros and not like in a way where it was overwhelming to me. I was just making sure I was getting good food
Sure.
in. And
Sure.
I'm crashing. So one of my missions in life now has been to help get the word out about what causes health issues so
Yeah.
that people can make their own decisions and have a real true ability to have informed consent, not just, well, here's the option I presented you because this is what
Fine.
I do. If I'm a carpenter, you're a nail, so I'm going to hammer you in. If I'm a surgeon, I'm going to cut you. If I'm a different kind of doc, I'm going to write a script. Like, I want you to be able to know what you're dealing with, at least enough to where you're like, yeah, that feels right.
Yes.
Or maybe there's something else because so often my experiences has been health is really not that complicated when you're taught the basics, right? Like it
Basic.
is
Yeah.
complicated. But if someone tells you that food doesn't matter and you're fatigued, it's like, does that really make sense that what you put over your mouth every day doesn't matter?
Doesn't
Because I
make
can't
sense.
tell you how many clients have come to me and
You,
like,
you know, it's funny that you say that because I always tell my patients, so it's interesting. You're aware that alcohol is going to make you tired. You're aware that coffee might make you wired, but for some reason your list ends there. Like there's nothing else possible that could do that to you when you ingest it, right? And before I continue, I want to say you made a really good strong point here, which is like on the outside you looked good. That was the same for my wife, who is the reason I got here. On the outside, size zero, vegan, was doing all the things. So sometimes those can be deceiving and we think we're chasing the right thing. How do we look? What size are we? What do we weigh? And inside, we're collapsing. Can you
mhm.
tell us a little bit about your story before we get into what you do? Tell us a little bit about your story, like why you even got into this.
Yeah. So my story goes back to it's twofold. It's twofold. It just like so many other things that we run into, it's never just one thing. When I was growing up, when I was 10 years old, my mom, who was this corporate America manager who was seemingly healthy and nothing could break her from, a poor family and made something of herself. At 40, her body just collapsed. She
Mm,
gained like 140 pounds on her
wow.
120-pound body. So
Wow.
she was 260. Her thyroid, stomach, cholesterol, everything shut down. I mean, I could go with diagnoses, but just imagine every chronic health issue that they medicate for often. Here's your pill. She had 40 pills. a day prescriptions at one point, and she looked at me and she's just like, I don't, I think this is like the end of the line. And I'm
This is
10.
not it. Yeah.
I need to teach you how to do the checkbook. Your dad's dyslexic. That's what I help him do.
Wow.
I don't know how much longer I'm going to be functional. Fortunately, my mom's still here with me. I have a beautiful young son that she has honestly, like, it's changed her entire world. Like, it's made our relationships so much better because she is just like brightening up because of my son. But at the time, that was for a 10-year-old, like, you either step up or you act out, and for me, it was step up, and I stopped getting in trouble at school. I gave up, just really childhood. I really just took ownership of the responsibility to my family to just be better, to not be a burden,
Yeah.
right?
Yeah.
And that continued till 30. But when I was 20, 22-ish, 23, I graduated from undergrad after being a multiple time All-American in track and field in college. And I was 250 pounds. I had food allergies developing. I was hurting
Mm.
all over. I was in pain. My energy levels weren't good. I was developing erectile dysfunction. I didn't really know what was going on, but that people are just like, "Oh, you're just getting older." I'm like,
Sure. I'm
I'm not 18
22.
anymore, right? Like every guy, like I know that's not the topic of the podcast, but every guy when you're at 18, like that's the peak. That's when you wake up and you got
Right.
morning. But it was like fading for me, like really rapidly. And I was just like, I guess that could be normal. Guys don't talk though. We don't talk
Right.
to each
Right. You
other.
don't talk. That's true.
And by the time I was 25, I was really crashing. But I was, like I said, I was a college shot putter. So if you've ever seen a shot putter, we're like big dudes, like muscular, but also fat. I was athletic, but big. And then by the time I was 25, I had a six pack. I was fit. I was like, everybody's mirror image of what looked good, but I was not good.
Right. Right.
I was allergic to chicken, berries, all
What?
berries,
The most
almond,
basic food.
dairy, sweet potato was causing my weight to go up. So like I was rotating foods because literally I'd step on a scale and I'd gain 4 pounds because I ate chicken. And I'm not talking like a whole chicken. I'm talking like a meal.
Yeah.
And I was just like, I don't understand what's happening. I'm going to all these conferences. And as you know, you go to a functional medicine conference, there's NPs, like the gamut. And
Right.
I kept asking people, like, I don't know what's wrong. What could cause this? And they're like, oh, take the little blue pill.
Yeah. They switch
Or
pills. They switch some of them. Some are great, but some switch from medication to just supplements without root
sure.
cause.
But even functional medicine doctors like, well, take L-arginine. Like L-arginine's good. That helps with vasodilation. Take N-acetylcysteine. Take
Sure.
whatever the latest thing was that could help with blood flow, ginkgo, and I tried all of it, and honestly, I didn't have results. And as a 25-year-old Midwestern male who's like family is what was bred into you, my parents are still together. Like I wanted to have a family, I want to have children. That was my vision. I was getting really down. Like I was
Yeah.
getting really heartbroken that I didn't
This
know
is
if I was going to be able to have that.
wow.
So a guy literally looked at me in a conference. He's like, I was at a conference not too long ago and I heard Lyme disease is really hard to find. Not a lot of people are talking about it. And this is in 2013. And that was it. I was like, do you know anybody that works with that? Nope.
Nope.
Do you know anything about it? Nope.
Nope. And
And I was just like,
internet was not like it is now.
and I'm excited and heartbroken at the
The
same
same
time because
time.
I'm like, all right, here's another rabbit hole, right? So I found a guy in Wisconsin. I drove from Missouri to Wisconsin, 8 hours. And it's like that one story every parent tells, uphill both ways. I drove through a freaking blizzard to get in February to this clinic to see if he could help me. And he did. And he was
Tell it.
like,
What did he do for you?
he got me on frequency specific technique microcurrent. He
Right.
got me on some herbal cocktails he designed. He worked on getting my immune system and my mitochondria going again
Yes.
through some different things. And I mean, now I'm using red light and saunas and getting people going that way, doing some fasting. And he had some of those things going with me. And within about 3 months, there was a significant change in my body. And it was a rough 3 months because this man was a farmer turned doctor, farmer first, doctor second. And he was just like, you just do things. Like we don't stop, we just keep moving. And I'm hurting and having reactions like crazy. And I'm not a sensitive person, like through supplements to this day, not sensitive, but from him, well, but
Okay,
yeah, I mean, It
If it's
changed
all
the
right with
game.
you, I just want to pause for a second because I want to make sure our audience knows what you refer to because not everybody knows what you refer to. So, when we're detoxing from, well, not exactly detoxing, but we're getting rid of Lyme and sometimes mold. If we do it too fast and too intensely, you can get a reaction, right? Which is what you meant by the herxing. And I imagine that when I did it with my clients, we go slow. We don't tolerate that. We do it to a place where you don't feel that way. It's not more is more. But this particular person you were like, we're just going to go and just do it all at once. So that's a really intense way to do it. I mean, it's fast, it's
Yeah.
speedy, but that's a really intense way to do it. So how long did it take for you to kind of get better? 3 months, you said?
Well, 3 months, I felt a significant shift. I wouldn't say I was better. It was 6 months before I was done with his protocols. And mind you, this guy was at the time, and I actually still talk with him, and he's expanded drastically. But at the time, it was Lyme and co-infections. That's what his focus was. And then you're done. So I probably got like 60% of what I now know to be health.
Mm-hmm.
And I was stoked. I was so happy.
Yeah.
After that, I actually was graduating chiropractic school. Went into practice myself, and talk about fuel or trial by fire.
Yeah.
He was just like, "Oh, virtual practice isn't a thing back then. I'm gonna send you all the Lyme people from the Midwest down there to you as a first day doc."
Wow.
So I'm getting Lyme clients into the clinic, and we're working with them, and I'm finding out that, oh, parasites are this person's issue alongside of why they weren't getting well from with Lyme from whoever else they were working with. And this person was living in mold, and this person had heavy metals, and this person complete dysregulation of the nervous system.
Sure.
So as I've been in practice now 11 years, I've really added all those things in. And of course, who do you do all this stuff to first? Yourself.
Yourself.
So
Absolutely.
I've done all those protocols, and I can tell you with each step, and really metals wasn't a big part of mine, but with each step, I was able to improve upon my health to the point where I'm 38 and I still do CrossFit workouts. I don't really need to sleep more than 5 or 6 hours to feel rested. I do because I know for a fact that's something that over time would knock me down. Like I feel good, and I'm not worried about crashes. I don't have food allergies anymore. So 6 months was the brunt of things. And then it was just like this learning curve afterward.
Yeah. I just want to make sure I would like to, because you and I are so steeped in it. This happens a lot of my guests. I always take pauses to make sure that everyone who's listening is on it. Because somebody might say, what does allergies have to do with this? So if your system is, and please feel free to add or correct me, if your system is on overload for the standard American diet and, starting there and not sleeping, and now on top of it, you have some sort of infection, parasite, Lyme, mold, your system is so dysregulated, your immune system is so now it's reacting to chicken and berries.
Mm.
And it should not be reacting to that. So, it's one thing to react to, I don't know, dust. It's another thing to react to the most basic of foods. And so when you calm that down by removing all these layers, and again, in a way, it's kind of good to happen to you in layers. It's hard to do it all at once. You suddenly find that your immune system is behaving appropriately, right? And that's why your allergies were gone. So I'm hearing though, so I got the personal piece, which is amazing, and I'm so glad that you and your mom are well, thank goodness. But it sounds to me like you never even had a chance to first practice like conventional chiro and then switch. It sounds like from the get-go you were in functional. Is that accurate?
That's completely accurate. And I wanted to touch on the allergy thing because the way I describe this to people is if there's an invading army crashing on the beach and your immune system is like the single machine gunner at the top of the hill, and there's thousands of people invading, like you're not shooting at one person. This is not a sniper situation, which is what we'd like our immune system to be like. This is just simply defend. And your immune system will do that. There's a lot of different terms that can happen. Autoimmunities can be following from when your body's stressed out. We see all the time when people are in mold, increase in autoimmune markers. So, yeah, I mean, if you're dealing with food allergies, autoimmunity, that is not a forever thing. It doesn't have to be at all
Doesn't have to.
always. It can be something that, and this is that informed consent piece. It can be something that is your body's misidentification of a body tissue, like your brain, your joints, your skin, a misidentification of chicken, berries, dairy, eggs, whatever it is, like it was for me. And if you can calm the system and then allow it to have time to go, oh, that's just chicken. That's good for me. Don't worry
Right.
about it.
We're okay.
Yeah. Then you get back to it. But to answer your question, yeah, from day one, which was the most beautiful thing looking back on it, is I was afforded the opportunity to have these really difficult cases with a mentor I could call for help,
Thank goodness. Yeah.
but I also could spend the time
Mm,
to really dig in and understand the difficulty these people were going through, do the research, expand my knowledge, and do it when I'm not seeing, 40 hours of clients. I'm not burnt out. I don't have kids like so many doctors out there are. So I was afforded an amazing opportunity to really pour my passion into these types of conditions,
sure.
which is what's brought me here today.
And the time component is so important because I don't think people appreciate on both sides of the fence. Like sometimes patients are like, why can't my primary care, do what you do? It's not feasible in the constraints of conventional medicine to give patients the time. So if you're going to primary care and expecting functional medicine, it's never going to happen. I always tell people go to primary care or anything conventional medicine for what it's good for, some testing, some probing, but time is what you need to spend with your patient to get to root cause, to hear the whole story of all of it. It's such a big component. And it's amazing that you had that time. For me, it was during COVID. There was not much I could do in my practice. We were just testing and, treating COVID. No one was coming out for anything else. So it was an opportunity for me to jump in. And suddenly I found time to do that. That's amazing. And I want to go back again because the more you say the informed consent piece, the more powerful it's landing for me. Because you're right, we learn in school and NP school, Chiro school, MD school, informed consent. Here's the paper. You tell them what the procedure is about. They're informed, they consented, but it's not really informed. It's not really informed. Like if I say to you, like, yeah, I mean, maybe, we'll do the surgery because you're in pain, but like maybe you're in pain for like so many other reasons that are not even presented to our patients. I think that is so, so powerful. So we're entitling today's episode Lyme, mold, parasites, oh my, because it's just so Lyme, mold, and parasites. We don't talk enough about it, I think, and my podcast so far. So I imagine you see it a lot. Tell us, I'm a patient, I come to you, I don't feel well. How are you determining which test to run, Lyme or mold or parasites, or are you running all of them? How do I know if I have it?
You know, we actually have like a standard start point of physiological lab test is what I refer to them as. They give us information. And a lot of times we'll have those run even before you get to me because that first call with you, I want it to be really useful for you. I want it to allow for me to have a lot of information. So, of course, labs, we all think this is just a sheet of paper that tells me something about you. I don't even need to see you. This is what a lot of clients think. I don't even need to see you to be able to make those make sense. And I'm like, no, that's not how it is. Those are a point in time test of some physiological markers that require me to understand what they mean to you. Now, they could mean a few different things. So we'll get in there, we'll do a long health history. I want to know how your life was all the way back to birth. I want to know if you were a people pleaser or if you had OCD or a perfectionist, because that's going to tell me about how your nervous system operates, which makes you maybe a little bit more sensitive to a toxin.
Mm,
Or it could lead me down a genetic pathway where maybe you don't absorb B12 as well. So you're MTHFR. That can lead to that perfectionistic personality because no one ever gave you the B12 to help those neural pathways work well. So I really want to know about you. I want to know if you've ever tested your house for mold or radon. If you've had dental work that could lead to chronic illness where you've had a bunch of root canals that could be filled. I call root canal a zombie tooth. You killed it, you left it in there, and then bacteria and all these other things get in that tooth and it comes back to life, but it's not necessarily on your team.
yeah,
So
I love
I'm
that.
do
That's a good
I
analogy.
I'm getting all of these different pieces of information, both from all the paperwork you fill out, but actually talking to you and interviewing you and understanding what it is that happened to you throughout your life. I'm adding then the labs afterward, and we create a roadmap out of your labs. And what I mean by roadmap is if you show me you have low vitamin D, okay, well, maybe you need vitamin D, but there may be a reason why you need it. Are you living in mold because your immune
Mm,
system is being
what's
suppressed?
draining it?
Yeah. If you have homocysteine, which is an inflammatory marker from blood that can suggest you're at risk for like a stroke, but it also is due to the fact that maybe you have low folate or low B12? Well, why aren't you absorbing those things? Is it genetic? Is it a digestive tract situation? So that can lead me down this path of the next steps. If you have elevated albumin, which is a protein in your CMP in blood, that elevation over about 4.6, at least is what I've kind of noticed in patterning, it means your body's likely in stress. So if I run a mineral panel, like a hair tissue mineral panel, and I see that your hair is depleted of sodium, potassium, you've been under stress for quite a while. Why?
Mm,
So I start looking at all these. I also run an organic acid test. And if you have markers like oxalates, a methylation issue, if you have Krebs cycle or fatty acid oxidation or the ability to break down fat making into energy, if you have issues in those areas, oftentimes I think there's a high likelihood you're dealing with mold.
mm,
So I've said a lot of connectors here because people have these labs. They can go look at them. They can pull them out and be like, that makes
sure.
sense. These things are out of range for me. So I'm taking those labs, comparing it to their history and understanding what they've been through and how that might make this make sense. And then we build out that roadmap of, okay, what next labs do we need to run? And yes, I will run Lyme testing if we see that your body's under a great deal of stress and we can't identify it from our basic labs. I'll definitely run mold testing if I see those mold markers on there, and there's several more in the mold section. If you're drinking radioactive water, which about 170 million Americans are, just look it up. There's a lot of major cities out there like Miami and LA that have radioactive water. And although a lot of filters claim they remove it, I can tell you, I do the testing. You buy a filter, we test before, we test after in your own body. Is it there or is it not? And there's one way to remove it well from tap, which is distillation. That was it. I wish it was easier than that because that's a pain in the butt. I have a
Mm,
distiller. It's not the easiest process to go through, but I'm just a guy that likes to get those finer details because I'm working with people that honestly, most of the time have been bouncing from doc to doc and
yeah.
they're tired of it. They don't want to spend more money on guesses and they want to move forward. So the last one I didn't really mention was parasites in this. And the problem with parasites are there's really not a lot of great testing. The gold standard out there has been stool samples.
Mm,
And stool samples, you can run 4, 5, 6 different companies' stool samples. You might maybe
capture.
find a parasite.
Yeah.
And it's just not worth running 6 tests. So that one oftentimes, as I start doing some gut cleanup for these people, because almost universally, if you're chronically ill, there's some gut cleanup that needs to be done.
Sure.
Whether it's the bacteria, the yeast, include the parasites in there, the inflammation, we got to do it. I include a parasite protocol in there as a part of that for a lot of people. I also go through the symptoms. Do you have a parasite path symptom? Do you have skin issues, gut issues like IBS, cramping, bloating? Do you have grinding teeth? Are your
Mm.
symptoms worse around the full moon? So those are just a couple of the symptoms that are associated with parasites. And I'm going to lean into it a little bit more.
I love that. So I'm just gonna say it back, make sure I understand it. You have some like a basic blood work. Well, I'm sure it's not basic. You have a starting blood work that you have your patients run, and then kind of depending on their symptoms and their labs, you know what to do next. Some will go to Lyme, some will go to mold, some will go to parasites. Did I get that right?
Close. Yeah. I
Tell
mean,
me.
there's the basic. And then after that, we run what's left. To be honest, it doesn't seem like you don't usually have like 2 of those things for most
Yeah,
people. I don't want to say that to all people. I'm not saying
a lot.
everybody
It's a
has
lot of
Lyme,
people.
everybody has a parasite, but here's the reality. I looked this up. I actually was doing a presentation here recently. 100 million people in the world are dealing with Strongyloides parasite. 1 million people in the United States each year go to the hospital, get diagnosed with Giardia, which is a singular parasite which you can pick up from going to the lake. There's also 2.5 billion of the 8 billion people in the world that are currently dealing with parasites. And these are on like World Health Organization. These are not hidden. These are CDC, World Health Organization statistics. So they are commonly accepted. As far as mold, the EPA said 50 to 70% of buildings have water damage, mold that can be problematic to
Sure.
people. And just to put you into a frame of reference, there could be 2 people living in a house and one of them is not dealing with the mold well. They feel sick, they're fatigued and brain fog. The other can feel perfectly fine.
Yep.
That's because we're all individual people. However, There is a genetic type, HLA-DR, which makes you about 50% more susceptible to mold is what my experience has been. It makes it to where you don't tolerate toxins as well in general, and 25% of our population deals with that. So oftentimes I've got spouses coming in, and one's saying, "I'm fine," and the other one's saying,
I'm
"I'm
a
not
mess.
fine."
Yeah.
And I'm like, "Okay, well, here's potentially why."
And that's a really important point because sometimes even in like an office building, you'll have like Susan will be a mess all the time. Everybody else is fine. And then they just say, oh, Susan must be crazy because no one else is sick in this building. But Susan is just more sensitive, having a harder time detoxifying. That is so true. And the other thing is like the people that come to you when you say so almost everyone has Lyme and mold, it's because the people that come to you are so sick,
Mhm.
right? So maybe not the general population, but the ones that will come to you and to me who've already been like dismissed all the way across the board are very high percentage are going to have these chronic issues. So if somebody has Lyme and parasites and mold, which do you like to treat first?
So actually, parasites is gonna be my first one. Now,
Mm,
that's a little backwards from what a lot of people say because like, "Oh, you have to treat mold first." I go, "Well, my statement is this: you have to be in a safe environment first. So
mm,
you have to be in a place where your body has the opportunity to heal. Now that can be the air, which is mold and radon, or other chemicals that are getting sprayed into the air. The food, so we're eating or an organic whole food diet. That's like my minimum, and then I'm going to go down more specific to the person, whether we found oxalates or histamines being issues in their bodies. We can specify that diet further, but organic and whole food, which means no, we're not going to the store and getting Lucky Charms or Fruit Loops. We're making our food. Then we go into water. They're drinking water that is clean enough that is not carrying toxins. So I actually look your water up on EWG, which pulls the EPA reports up, and I go, "Hey, what's in your water? What are you using to filter? Is this water acceptable?" We get into hygiene. We go into the dental, like I talked about. Do you have a zombie tooth earlier? We get from there into implants. Do you have any implants in your body? Some people, unfortunately, I've got this checklist that we go through, every one of my practitioner in my clinic go through, and I'm like, check the boxes off to make sure they're in a safe environment so that we can take the next step. And if
yeah,
they haven't done that yet, that's where we're beginning. We're not even worried about necessarily like getting into this big detox supplement protocol
yeah.
because we're curating that environment.
They won't be
And
able
then
to
once the
handle the protocol.
exactly,
Yeah.
exactly. And once we've done this, now that the environment is safe, and by the way, I will include this, the people in your environment matter. They can be a
Mm,
parasite too. If they're
mm.
sucking you dry, then it's really hard to have extra energy to heal.
So true. So true.
So my second stage is, do you feel safe once your environment is safe? Because so many people will say, okay, I've done the mold work, I've done all this other stuff, but their anxiety is still through the roof. They're still worried about mold in their house. They're still thinking about every product. They're worried about eating. They don't even want to eat because they're worried there's
Yeah.
toxins
Yeah.
in it. And I go, yeah, infections and toxins can create inflammation, leading to brain symptoms. I can run a neural zoomer blood panel to show the autoimmunity that can be caused by these triggers. That leads to anxiety, that leads to irritability and worry. However, if you aren't feeling safe then it's no different than running from a bear. If you're running from a bear, what are you thinking about? The next step. Where's my next foot placement going to be until you get away? And then you worry about eating and breathing and everything else
Right.
that you gotta
Right.
do in life. So, I'm always getting people to work on regulating their nervous system, whether that be through vagus nerve exercises, doing limbic or somatic work, neurofeedback, and so many other amazing tools out there depending upon the person. So it goes safe place, feel safe, and then I get into opening up those drainage pathways and detox. Like you gotta poop. So if you're not
Yes.
pooping, at
Not going.
least a full good movement every day, we're gonna work on that. Then we go into the liver. And by the way, you can have parasites in the colon that are releasing endotoxins that stop you from pooping. You can have parasites in the liver called liver flukes that are damming up your ability to move toxins out. So imagine you lived in mold, you got it all cleaned up. Your doctor says you have to do mold first. You start mobilizing mold out of your body. It
You
gets
get
to
it
your
out.
liver flukes like, ha, roadblock. That then toxin gets released back into your body and now it goes somewhere else and irritates something else. So I've got to make sure those drainage pathways are opened so that we can get all the junk out when we get there. So that's why parasites, being a large multicellular
Mm,
organism that can back up lymph, liver, and colon, for me, has to be one of the first things to make sure it's cleaned before we go into all the microtoxins
I love this.
that are going to be needing to come out.
I love this. The order really counts. And I always say that because people, they're sick. So I'm not saying this with judgment, but people are like, they want the test and then they want the protocol. And it's like, whoa, n- you can't handle any of this. And the mold piece, I agree with you. The mold piece, when I used to treat patients, was always at the end. And to add to your point, if you're dysregulated and chronically stressed, you're actually never gonna be better because you're stuck on illness, like, your system's
Mhm.
like you could have the mold, the urine numbers go down and the mold looking better and still be unwell, so I love that order, I agree wholeheartedly in that order, and then in your clinic, you are comfortable managing the Lyme and the mold detox and everything else, you're doing all of that on your own, or do you have, like, people that you send out to specialists?
So it all depends on the person. We do probably 99% of it ourselves because we're able to do it when you get a person into that environment and feeling safe, their body just turns on. They're
Yeah,
getting stronger. So we do 99% or so on our own because when you get somebody regulated from a nervous system perspective, living in a safe environment, their body starts turning on. Their immune system starts kicking out the parasites. It starts kicking
mm,
out the Lyme. It starts actually operating the way it's supposed to. So much of the time, something had to knock us down. Maybe that was living in mold. Maybe that was, in my case, you know, having this responsibility dropped on me at 10. Maybe that made me
mm,
susceptible where I was in this like fear state, what, not even consciously, but this just
sure,
overactive state in my body. Maybe that made me more susceptible to Lyme when I was younger. But to be honest, for me, it was actually mold. I was living in a basement where I could see mold 4 inches up the wall because
wow,
it was cheap. It was a big space and I didn't know any better. So when you do that, you have some really positive things happen. I also have a nurse practitioner in my clinic. I've got a medical doctor on staff that's licensed in like 12 states. So we're able to support people with medication in a lot of places. And if we don't have the ability because you're not in our licensure areas, then we just refer to a local clinician to get meds that you may need as we're working through the lifestyle and the detox protocols. So we're able to really do a lot without needing to bring too many people in. Because for me, I have not found in my experience that high dose IV or PICC line or even oral antibiotics really do a ton of amazing work for people. I just haven't seen that. I've
mm,
looked at PubMed and there's a lot of studies that are showing that antibiotic use after about 2 to 3 weeks of having Lyme disease actually doesn't really show a whole lot of efficacy. So for me, it's more about those first 2 steps and then regulating the biome. Actually, I call it balancing the biome
yeah,
because if you can balance a biome, what's a biome? A biome, we all think of microbiome, just the gut, but if you look at biome, it's a set of organisms and their environment and how they interact. Well, what is a human? We are all kinds of different microbes, parasites, bacteria, yeast, molds, all of these things with human cells. So this is our biome. And our environment is all the things that come in, all the toxins. If we can balance all those microbes with our cells and keep out the toxins that dysregulate that, our body operates phenomenally. And I've seen this over and
yes,
over again.
agreed.
And so many people that are hammering out the PICC line antibiotics, they're missing the boat on that. So the person never gets to the point of actually being well. I had a client come in with a PICC line antibiotic, 8 straight years for Lyme.
Oh, oh my god. There's nothing left of this microbiome. Oh my god.
It took me a year to convince her, even once working with me, that she was making progress, which her whole family saw. Like she went from not being able to walk to the end of her driveway to being able to go walks around the block. And finally, her family's like, "Are you done with that pick line?"
Yeah.
And then we worked together for another year and she was able to start going to the gym and working out. She actually, because of the pick line, couldn't raise her arm above like
Oh
her
my
shoulder
god, of
because the
course.
pick line was in.
Wow, that's crazy. Wow. Oh my goodness. Okay, this is great. What do you wanna tell our shared audience that maybe I forgot to ask?
You know, It sounds scary when I'm throwing statistics together. 2.5 billion parasites, 50, 70% of homes have water damage mold. And the reality is this: we are a biome, and in every biome around the world, it's resilient when
Mm,
you balance it. So you don't have to be perfect. You don't have to know the exact way to get well. And you don't have to take every pill. I tell people, like, look, if you're 90% of my protocols, we're good. Well, do I have to take it before or after dinner? It doesn't
when,
really matter for this one.
whenever you remember.
Yeah. Like, you don't have to be perfect. And trying to be perfect will probably keep you from getting well
Yes.
because it'll stress you out too much.
Yeah.
So, what the reality is, your body's meant to thrive when you bring balance to it. There is an order, there are very important things. Test, don't guess. Get a person to support you that can walk you through the pathway, giving you steps, telling you where there is room to wiggle so that you can make it through. Because I always want people to do this. I want them to focus on life so I can focus on their health. And we find that balance between each other. And I'm like, hey, look, do this and this. Drop the 12 therapies you're doing, cut the 45 different supplement pills you're taking. Let's get 5 to 7 pills at most, because otherwise it's expensive poop. And we're going to be able to see real results when your body knows that it's moving towards safety, not when it's panicked from being unsafe.
Oh my God. I love that so much. So many great things. And you know, my favorite is the informed consent. That's going to be my new favorite. I love that. Dr. Jaban, this has been amazing. We're going to put all your links. Do you want everyone in America to come to you? Because everyone in America is going to come to you. Is that okay?
Bring them. We're going to help as many people as we can.
Amazing. I love that. So we're going to put all our links and everything in the bio. And if you are suffering, and especially if you've been everywhere already and you want to start considering mold, Lyme, parasites, Dr. Jaban's the place to go. Thank you so much for being here.
Thanks for having me.
Of course.